Everyone, and welcome to the session Quality and Services, a Career Perspective. We've got two speakers today who are going to talk back to back. If you've got any questions, we're going to do them at the end, so it'd be really helpful if you submitted them via the app. If you have any trouble at all, Nellie here will give you a hand. She'll either speak them out for you or write them down or whatever is needed. So first off, we have Ciara Lawrence, who's joining us from MenCap, and she will be followed by Dr. Andrew McKechanie from Edinburgh University. So over to you, Ciara.
Good afternoon. Thank you so much for inviting me to speak at the ITAKOM Conference today. I'm really delighted to be here, and I'm delighted to speak to you all. My presentation speech theme today is, what does a good quality of life look like? I will talk about my life as a person who has a learning disability and the support I have had to achieve a lot in my life with the right support. In 1997, I started my first relationship. I met Mark at a local college in the student canteen and asked him out. I was a bit cheeky. At first he said no. So a week later, I tried to ask him out again in the student canteen, and he agreed to go on a date with me, so I was very happy. That day, I bought him a burger and chips, and we had lunch together, and we chatted, and he was really nice. We like going on dates to the cinema, we like going to the theatre, we like going to music concerts, and we love spending time with each other's families. When I was growing up, I wanted to have someone that I could spend my life with. My relationship is very important to me. In 2008, Mark and I got engaged in Ireland away on holiday. And in 2013, we got married. And in May this year, it will be 10 years, which is a really big stepping stone. We are just like any other couple. We bicker over the washing up. We bicker over the TV channels we want to watch. So we're like any other couple. People with a learning disability have the same rights to have friendships and relationships like anyone else. My mum and dad have been my supporters while I grew up. And when I was younger, I saw my brother achieving big things. I wanted to achieve the same things. My family helped me to start achieving by opening my mind to try lots of different work experiences to see what I wanted to do for a job career. I did some work experience in a local children's nursery. I did some work in the library, and those who know me are very shocked when I say that. I tried work at a car company. I tried work at a leisure centre. So by having lots of different experiences of work, it helped me to decide what I might want to do. But then after a while, I realised I might need support to have a job and to hold down a job. I then went back to the job centre with my mum, and we kept campaigning to get the right support for me, to get work with support and the right support. This is how I found out about the learning disability charity MenCap. While I've been working at MenCap, I decided I want to live independently and have my own place to live in and be independent. My mum supported me to think about practical things like paying bills, paying rent, and looking at what it might be like to live independently. I also learned a lesson about budgeting money as well. We went to speak to people at the local council housing office about my different options and what was available. I was then offered a council flat through a private landlord. It was very exciting, but also a bit scary. I wanted to prove I could do it and be able to keep my home. I said yes to it, and we went to look at the flat. A couple of years later, there was an issue there, and I sadly had to move back to my mum and dad's house. About a year later, Mark and I moved into our first rented flat together, and we lived there for 2 years. In 2012, we moved into another flat, and we lived there for 8 years. In 2020, in the COVID pandemic, we were very lucky because we found a lovely new flat, and now it is our forever home because my family helped buy it for us. I met the disability job officer at my local job centre. She got me introduced to the team at Sutton MenCap, where I grew up, and they gave me a part-time job as an admin assistant. I was able to try learning new things and learning new skills and building on my skill set. It was during this time I started meeting people with a learning disability like me who they supported. I then decided for my next job I wanted to work alongside people with a learning disability like me so I could talk with them and understand the barriers that they faced. As a person with a learning disability, I wanted to build my skills and my career and get the right next job. So then they offered me a work skills course assistant job. I supported 2 young adults with a learning disability into a work experience placement, and they achieved a lot in those jobs, so of course I was very proud. I was then asked if I would move jobs and go and work at the Lambeth MenCap Employment Service office, as they needed someone like an admin assistant to run their team office. I agreed, and I ended up being there for 2 years. After 2 years, I wanted to try something else, get a new experience, build on my skill set. So I found a job on our MenCap job shop as a celebrity research assistant, and I was successful in getting that role. While I was working in that team, I also applied for a part-time receptionist job there, and again I was successful in getting the job. This meant I could work in the London office full-time. 1 year later, I wanted another new experience, so I applied for a job as a part-time campaigning assistant in our MenCap campaigns team, as well as working on reception. The job was really interesting, and I wanted to stay in the campaigns team as I'm very passionate about learning disability. So my colleague Josie, who is one of our amazing receptionists, and I were offered a job swap trial opportunity. Josie was given a full-time role on our reception desk, and I went and trialled working in the campaigns team full-time. The trial was really successful, and we ended up staying in our roles permanently. I am now currently working at MenCap as engagement lead. This job is about talking and actively listening to what people with a learning disability tell us should be better, and then we try to do something about it. For example, they told us the IT systems were not accessible, and now we have a MenCap IT work group, which I chair, and our IT emails are getting better, which I'm very happy about. I also do work on inclusion and our big plan, and the keynote message of the big plan is we want people with a learning disability to live happy and healthy lives. I'm also now on MenCap's leadership team, so I'm now also a leader, which I'm very proud of. I've been at MenCap now 22 years, which is a very long time, and I currently work as engagement lead. So, outside of MenCap, I do lots of other things that are amazing. I'm a trustee of another charity called Head to Head Sensory Theatre. They're a Surrey-based theatre charity. I'm also a trustee of the Sunny Bank Trust. They are a Surrey-based LD charity. I'm also a patron of 2 other charities, Include.org. They're a Surrey-based disability charity. They aim to support people who have communication difficulties. And Dance Syndrome. They are an inclusive dance disability charity. So please go and look all of them up, and they're amazing. Outside of MenCap, I am also an ambassador for Joe's Cervical Cancer Trust, and I'm a Get Lippy campaign ambassador for the Eve Appeal. These two charities aim to raise awareness of women's health issues like cervical and gynae cancers. I got my roles in 2019 after losing my own cousin to cancer at the age of 48. I wanted to do something in her memory to raise awareness. I wanted to help raise my voice about the importance of women going for a cervical screening, and I'm sure my cousin is very proud of what I do. So, also, in the COVID pandemic, when I was at home, I wanted to start a new project. So I started listening to some podcasts online, and they were about different subjects. Some of them were about raising awareness of charities. Some of them were about raising awareness of important causes too. I decided it would be great to have my own podcast. So I raised up some money to buy me some equipment like a microphone, and I bought a book called How to Start a Podcast, and it gave me really good tips about how to do it. And so I tested the water, I got some people on to do interviews with me, and it went really well. And now, a year and a half later, Ciara's Pink Sparkle podcast is still running online. You can find my podcast wherever you get your podcasts from, like Spotify, Apple Podcasts, and all good podcast places. So please give it a follow if you are on those accounts. Some of my guests have been Krishnan Guru Murthy from Channel 4 News, the comedian Rob Brydon, who also plays Uncle Bryn and Gavin and Stacey, the Radio 2 Joe Wiley, DJ, and the TV and radio presenter Gabby Roslin. And there are some brilliant episodes coming up, so please tune in over the next few months. So, quality of life. Many things make a good quality of life. Having good health, having family and friends, money, having a home of your own, a feeling of belonging, being part of a community. They're really important things that make up a really good quality of life for someone with a learning disability, and they have those rights like anyone else. I've been really lucky, and I have had the support around me to live a good life. But there are 1.5 million people living in the UK with a learning disability. They're not as lucky as me and don't have the good support I have had, or are able to speak up like I have been able to. But they should do, and they should get the right support. Thank you very much for listening to me today. Please can you send your questions on the app, and I will try my best to answer these at the end. Just quickly, you can find me on Twitter. I'm at Ciara, CIARA, LE01. You can find me through the ITAKOM hashtag, because I've been tweeting today. And I'm also on Instagram, I'm on Facebook, and I'm on all good social media accounts, so please find me and say hi. Thank you very much.
Lovely. Thank you very much, Sarah. And as I said, Ciara, earlier, I was going to struggle to follow you. That was a fantastic description of what good quality can look like. So thank you. So just a quick overview of what I'm going to cover in this. So I have a bit of an introduction about me and the perspectives I might try and bring to this. I've got a slide on a guide to quality care that's already been developed, and then a slide about deliberate design, something about tailored activity, something about addressing specific needs where we identify them, something I feel very strongly about, which is the role of welfare support, in delivering good quality care and services, and then a slide on accessibility. So, by way of introduction, I'm Andrew McKechanie. I'm a consultant psychiatrist in a community learning disability team for adults in East Lothian, which is a rural area of southeast Scotland, not far from here. I also have a part-time role at the University of Edinburgh, working at the Patrick Wild Centre. This is a research centre focusing on autism, Fragile X syndrome and intellectual disabilities, where my work really focuses on rare genetic causes of learning disability. I just put this in here that my journey into working in these areas started in the mid-90s as a volunteer for what was then the Scottish Down Syndrome Association, as a somewhat green helper on residential holidays for children and young adults. Fond memories. I've also been a board member and trustee of Scottish Autism, and some of the services I touch on are run by Scottish Autism. Scotland-Malawi Mental Health Education Partnership was a charity I was involved with. Again, there's a detail on that here. And then finally, one of the hospitals that I talk about is run by the Defence Medical Services down in England. So I thought, Sue Fletcher-Watson had asked me to speak here and had asked me to speak about some quality services. And I was thinking about, people have done guides to what quality looks like. There have been many exercises, and this is one of my favourite guides to quality service. It was done by the National Autistic Task Force a number of years ago, published in 2019. And even though its focus is on quality care for autistic people, when you read this, it is so much of it chimes as what good quality services look like for many individuals, and that much of it chimes with my own work, working in a learning disability team, and I think it will chime with many other areas of interest to people here. So these are the 10 elements that they sort of distilled what quality looks like into, and I think if you read through them, you will see something that speaks to all of the areas of quality that we would all aspire to. I suppose the services, I'm aware, having been to some of the workshops, we were talking about services in health, social care, education. Spoke to somebody speaking about quality in criminal justice, so that these are not confined to one discipline or one area. Quality has to be found in all these different areas. But I think sticking to these principles would be a good start for any service. So respecting, promoting autonomy, supporting communication, person-centred care, looking at environmental factors, removing barriers to access, fighting stigma, recognising behaviour as distress, ensuring better transitions, ensuring ongoing practical training, and accepting difference and supporting positive identity. I think there's an excellent start. I'm going to go through 4 or 5 different areas that I have worked in. I've seen elements of what have felt like really good quality care. I hope some of them you'll agree with. It's not comprehensive. They are some highlights. I should also say that because of my background, I'm a psychiatrist working in a community learning disability team, and even though I've had experience in other settings, by its very nature, my experiences will reflect the settings where I've worked. So I don't have that full breadth of quality services in every area that might touch your lives. Nonetheless, I hope there may be elements that we can draw from. This is an area that I think can be really important for quality service. I've called it deliberate design, and this is designing a service in advance of its need, often inspired by the way things have been in the past, but a deliberate, we are going to create a service. What should it look like? So this is a service designed and delivered by Scottish Autism, which is Scotland's largest autism-specific care provider, and it's called Founder's House. I think it's a ground floor residential accommodation. I think it supports 8 autistic older adults, and this was built and designed from the ground up. Issues to do with accessibility, sensory environment, the architecture of it. Many of the rooms have widened doors for those with accessibility requirements. There are hoists where required. There are specific details to the individuals who are moving in that allow the house to be a sort of low arousal environment suited to the individuals going in. And it just seems, it is a shame that it's not always possible for everybody, or hasn't always been possible, but it should be an exemplar, I think, of how a service can be delivered. This deliberate design of what it should look like, rather than, oh well, how are we going to change things to make it slightly better? This to me is an aspirational. We should be designing from the bottom up. With that in mind, somebody recently highlighted to me that the British Standards Institution recently issued this was October last year. This is their British standard guidance on designing the built environment, which I haven't read the document in any length, but this is from the sort of executive summary at the beginning, that these are some of the areas that they consider within scope, and provide some suggestions as to how the built environment can be more accessible and more friendly to a neurodiverse group. With that in mind, I think we need to always remember that one size fits none. And there is no, this does not describe a single environment that will be suitable for everyone, but rather gives, I think, guidance on the kinds of changes or the kinds of design that may be more suitable. But as we saw in the previous slide about Founder's House, tailoring of an environment needs to be specific to an individual where at all possible. This may give us some ideas about how an environment may be more suitable for a group, but in many cases we want to be thinking about how it can work for an individual. So it can only ever really be guidance, but I think it's good to see institutions thinking about these kind of designs. And it is the first version. I imagine it will iterate over time, and it's the kind of guidance for builders and developers that you would hope may help. Okay. My colleagues in my community learning disability team will be tired of me saying this, but one of the most important things I think about a service is about activity, is about meaningful activity for individuals. And when that isn't provided, that is often where, in the people I support, I often see difficulties, where there's either a lack of activity being provided, or where the activities that are provided are a mismatch with the individual's needs as well as their passions or enjoyments. So I've got a number of people in mind when I'm saying this, but I can think of many situations where a care provider, often short-staffed with a high turnover of staff, trying their very best, but is providing a service that looks quite generic. A handful of individuals where service looked like, well, we'll pick you up at 9 and we will go a walk up the high street 50 yards and we'll go for a Costa coffee, and then after a Costa coffee we'll walk back 50 yards to your accommodation, and that's the morning's activity. And a handful of individuals in mind where actually physical activity was really important for them. 2 or 3 individuals with ADHD who really enjoyed a lot of physical activity, and the care providers hadn't really understood this wasn't a preference, this was a need. And in the evening, after a day with limited activity, would have, still felt agitated, or still felt, as if they needed to go out and do more activity. And in one situation, changed care provider, changed the activity through the day, lots of walking, basketball, swimming, filled it with things that the individual wanted, was, sort of actively chose, I would like to go back to my class where I did basketball. And then once the activity was back in place, transformational in a number of cases. Someone who was previously very distressed is now at complete ease. Is excited in the morning to go out to basketball, and in the evening is relaxed and tired. So it's activity feels so important, but it's I think sometimes it becomes, we have to deliver something. It doesn't really matter what, but finding the right activity for individuals, certainly in my service, is key. So a scenario that is not uncommon is, here we have, beforehand activities decided by someone else. There's a loss of control for the individual with a negative impact, but when you get it right, autonomy can be restored, activities decided by the individual, and we can have a really positive impact on individuals. This may seem, apologies that the talk is somewhat tangential from slide to slide, but this was an area of what felt like a quality service that I touched on many years ago. So I was working in Malawi, teaching at 2 of the different colleges over there, and this is in a place called Mzuzu in the north of Malawi, and this is adjacent to a psychiatric hospital over there, which had both an inpatient area as well as a sort of a community outreach hub. And this, as you'll see, is the hair salon. And this was a project designed and delivered by service users of the hospital and the community outreach service. And they had identified that hair care was a really important aspect of holistic care for individuals accessing the services. And they recognized that often when individuals had become mentally unwell, that hair care, as well as often other aspects of physical care, often deteriorated, and that it was quite stigmatizing, or could be very stigmatizing, that poor hair care was externally visible, and traditionally, one way of addressing that would have been quite sort of radical haircuts, whereas the service users identified that if we have our own hair salon where we can help with hair care at the point of somebody accessing a community service or a hospital service, that could retain dignity, it could restore a bit of self-identity. Also, the patients that we spoke to described this, the very physical and intimate act of hair care, as being a personal connection. It wasn't an intense interaction. It was alongside each other, a peer support, where yes, it happened. It happens to be through the medium of hair care, but actually, it's a wider issue about peer support and about identifying a specific need for someone. and delivered by someone who has walked in those shoes. So yes, I'm showing you a picture of a hair salon, but I think the point for me is about an identified need delivered by people who have walked in those shoes and providing that peer support. So yes, salon run by current and former service users, identifying hair care as a priority for recovery, and promoting identity, self-worth, and for some of them also developing, life skills. So a number of them had gone on to, be involved in the running of the salon and sort of potential spin-outs from that. So it was a great industry. Okay. So this is a slightly fuzzy photograph of Duchess of Kent Hospital in Catterick in North Yorkshire, where I worked about 20 years ago, and most of the people attending the hospital worked in the military, and many of them would come in. I was working as a trainee psychiatrist at the time, and many people would come in distress, often anxious or low in mood, and we're asking for help. And as a psychiatrist, I would take a history, trying to understand what was happening for them, all the sort of different contributing factors towards where they were today, why they were sitting with me on this occasion. And it was striking that so many of the issues that caused distress were rooted in the person's social situation, to do with their housing, poverty, relationships, to do with their wider social welfare, if you like. And in many occasions, we had welfare officers, so there was the Red Cross provided a welfare service in the hospital, as well as working with the welfare officers within within the employers, so the military. In so many occasions, the answer to the distress wasn't specific mental health support. It was trying to address, as I've said here, the causes of the distress. So person after person would come in and tell me their problems, and I would say, well, I don't think I should do anything or change anything or prescribe anything, because it strikes me that the issues that you're talking about, surely we should be able to address these. And in many cases, we're in the privileged position because the military for these individuals was employer, housing provider, arbiter of, interactions with others, decided where their partner lived often, because many people had partners also in the military, actually trying to address some of the causes of the individual's distress was what was needed. And so that, it's one of my very early jobs, but it led me to think more about social and environmental factors that are really important in causing distress, and therefore, we should be focusing a lot of our effort on trying to address those issues. So I think appropriate, a quality service should recognise these, broadly I've called them welfare issues, and do what we can to support them. I'm lucky in my community learning disability team we have 6 or 7 social work colleagues who are dedicated to working with adults with a learning disability. That's their focus. We work very closely together, and these are the kinds of discussions that we have all the time. What can we do to improve this person's housing, activity, the relationship with neighbour or flatmate? Money seems to be an issue here. What can we do about access to the correct benefits? So these really important societal issues are important, and I think we need to deliver a quality service, we need to focus on trying to deliver on some of those. And then finally, I've got a map there. That's one of the local hospitals. It's deliberately sort of indecipherable to show how difficult hospitals can be to navigate. But this was really just a slide talking about accessibility in its widest sense. Many of the people I see struggle to access the general hospital. Many of them access it perfectly well, but some struggle to access the general hospital. And we have our learning disability liaison nurses who do a fantastic job in helping to navigate not just the physical geography, but more commonly the systems that are in place ostensibly to simplify things, but often only serve to complicate access. So accessibility, when it's done badly, can be a real barrier to service, but done well is essential and can help deliver higher quality services. So that was a slide on that. Oh, I'm getting the nod that, so my timer here isn't working. I've been trying to keep an eye, so thank you, Sarah, for the nod. So summary, we've covered a bit on deliberate design, tailored activity, addressing specific needs, welfare support, and accessibility. And that's all I have for you today. So thank you very much, Susan.
Thank you. Thank you, Andrew. So we've had a few questions come through on the app. The first one is for you, Ciara.
Yeah, okay.
Would you say it was better for the people you supported to be supported by someone who also has a learning disability?
Yes, I believe so. Thank you for that question. Yes, I believe so, because obviously growing up, I faced many barriers of discrimination, obviously getting a job, getting access to healthcare. So I really understood what it's like to be a person with a learning disability. So when I was supporting other people with a learning disability, and they told me the barriers they were facing, I said, I know, I've been through it too. And we were able to chat and talk and share experiences. And I found the word was being able to be relatable. I related to them. I understood them. Kind of, it's not a very accessible word, but they kind of became my tribe, and kind of we all understood each other. And you know, when I took them to their work experience placements the first day, the employees said, well, we don't know what they can do. What can they do? And I said, well, that's why I'm here. If you tell them what to do, I will help support them to do what they need to do. And literally after a month, the employees said, wow, we've seen what an amazing impact they've had. And it's because they just had somebody there that understood them to break down things to them, and then they could do a really good job like anybody else. And it changes attitudes. It helps people to understand what a learning disability is and what a learning disability isn't, and just to see that they're people like anybody else. So short answer is yes, it's important because you can come alongside them and you're like them, you relate to them, you can chat to them, get to know them as people, and then I can go, okay, well, maybe I can take some of the things they've taught me and put that into place. And actually, you know, then I've gone on to have a career in the learning disability world, and I've worked with lots of other people with a learning disability like me, and they're just people like anybody else. They just need a bit of extra support in their lives to achieve, and once they have that, they can do anything. Yes.
Thank you, Ciara. That was really well answered. Andrew, who gets to define whether a service is high quality? Is that driven by the people receiving support or the needs of support organisations and family members?
Okay, that's a good question. I think it should be obvious that the individuals receiving a service should be in the driving seat for defining what quality looks like. Sadly, I think that voice is often lost. I'm thinking of one person in particular who was getting what was clearly not the quality service that they needed, and they were trying to, eventually they were able to have that heard. Others around the person tried to amplify their voice, but I think the focus has to be on the person themselves and what they are reporting as a quality service or what's not a quality service. I think at a different level, there is a responsibility on commissioners and planners and people who may be developing services to think from the outset about some of the elements of deliberate design. You know, before we have a service and users of that service, we need to think about what that might look like, and you know, that would usefully include feedback from people who may use that service to help design that, you know, in advance. I don't know if that quite answers the question, but I think in the driving seat of thinking about quality, it should be, you know, it's not a quality service if everybody else is saying this is high quality and the people using it are saying it's rubbish. You know, I mean, there's patently no point in that. So it's okay. Thank you.
The next one's for Ciara. What's the most important thing? Well, sorry, what most important thing did MenCap do to help support you having a good quality life?
So 22 years ago, when I first walked through the door of MenCap, I was told I was stupid. I was told I was lazy. I was told I would never achieve. And MenCap said to me, if you put the hard work in and if you put the effort in, we will support you to achieve your dreams. And that for me was a real lesson to learn. And I was like, do you know what? I want to prove to all these people I can achieve. I'm not lazy. I'm not stupid. I just want someone to take a chance on me. And it's been amazing. MenCap have literally given me my voice back. I didn't have a voice before I was at MenCap. I didn't have a job. I didn't have anything. And now I'm married. I live in my own home. I have a career. I'm a podcaster. I have so many things now that I do, and I'm able to get the right support to do all those amazing things. And it's just sometimes, it's just about speaking up and going, please, can you help me with this? Or can you support me with this, please? Or can we talk about this? I want to do this. Can we put that in place? And it's happened, and it's amazing. And I just want to, I am now kind of like a role model, an inspirer, and I'm now in my 40s, and I'm like, do you know what? My legacy now, it's very clear. It's to inspire the next generation of people with a learning disability. There are so many young people with a learning disability coming through the disability world now, and I want to show them what I've done and gone, right, I'm going to give you the baton now. Now you run the race. And I want to see the world change for them. So I'm doing all I can now to kind of run that race and give it over to them. So, yeah, MenCap have given me the world, and they've given me my voice, and they've helped me achieve all my dreams. And they're an amazing organisation. And yeah, and from that, I've been able to go on and do lots of things outside MenCap as well in my own personal time. So, yeah, I've learned a lot because of the confidence they've given me.
Thank you. And on a similar sort of line, what was school like for you? Was there anything at school that you found helpful?
I had an awful time at school. I went to 3 mainstream schools. I had a rubbish time at mainstream school. It was at the age of 10, at my 3rd mainstream school, I was badly bullied at my first 2 mainstream schools. The teachers just put it down to sheer stupidness. And then at my 3rd mainstream school, there was an issue, and it helped bring to a head that I needed support. I needed to be somewhere where I was understood. So in answer to your question, my school life was awful, but then once I got statemented for special needs education, I then went to a special needs school, and I know there's a big debate about mainstream education versus special school, but for me back then as a child of 10 years old, my parents made the decision for me, actually it was best for me to go to an SEN school because that's where I needed to be, and I left there with 5 GCSEs, which I'm darn proud of. So in answer to your question, I had a bad time at school. They didn't help me at all. And it was only until I went to my special needs school that I saw I could achieve and that I had the right support to achieve. And from there, my life has changed. So, yeah.
Thank you. And for Andrew, interested to hear how things like promoting a positive autistic identity translate to LD practice when the rhetoric is still so deficit-based.
I think we only need to have listened to Ciara's fantastic presentation at the beginning to hear about quality of life that you touched on, and to think about the positive identity that you spoke about in all those different settings, both with MenCap but also all the different areas that you work in. So I would like to think that in my practice and within my team, we are trying to build people up. I was speaking at lunchtime with somebody who's doing research with parents with learning disability, and talking about some of the barriers that group face. And I was proud thinking in my own service we have staff who have a particular interest in supporting parents with a learning disability. So, and that is very much about, very positively focused and skills focused, and thinking about supporting an individual rather than thinking about what can't be done, but rather thinking about what people can do, and people's potential to do more and grow and develop, rather than thinking about deficit. So, that's just one example, but I understand where the question's coming from, and certainly historically a lot of focus has been on, and we see this in all of the topics being covered in the conference, these 2 days in neurodiversity, that focus in the past has been on difficulties rather than strengths. But I would like to think that we are pivoting more to focusing on strengths and what can be built up and celebrated, rather than areas of difficulties.
And has there been anything that you've introduced into your own practice?
With regards to anything in particular, or others?
Have you introduced any universal deliberate design aspects into your own practice?
I think within our service, some of the accessibility areas. We have a service user group who were involved in developing accessible letters, sort of appointment letters, to try and promote that sort of independence and communication. In terms of geography, I have clinics in 2 or 3 different towns, but in addition to that, offer routinely home visits if easier, if better, visits to other day services that people might be attending. I've got one person in particular I'm thinking of who would find face-to-face interactions very difficult. So when I see them, we always go for a walk together, because being alongside, side to side, for that individual is much easier than face to face. And so people who had been before it had been difficult for the individual to access, but actually we regularly meet up, we go for a walk together, we speak side to side, and that is a format that has improved the accessibility to healthcare, and to take that forward. So I'd like to, I'm sure there are many areas in which I can do better, and we ask for feedback from our service users about what we can do to improve, and we try to incorporate that then into how we can change services. So I'm sure, I'm sure there are things I can continue to do better, but those are some of the things that we are trying to do.
Thank you very much. I know there are loads more questions that have come through, but unfortunately we've run out of time. But thank you very much to our 2 speakers, and that should leave you 10 minutes to move on to the next session.